Hello there. Good morning, good afternoon, good evening, depending on where you're tuning in from. Dr. Deka Ifobi, board certified neurologist, keeping it real. So, we're going to continue our talk on seizures, and we're going to talk about seizure first aid today. We mentioned briefly in our last video about when you contact EMS for seizure. So, today we're going to talk about what you do with that seizing patient when you are in the midst of someone with a seizure. If it is your loved one, you probably already know their family history, medical history. You kind of know what to do. But if it's a stranger, you may not know what to do. So first thing you do is stay with the person until they're awake and alert. You don't want to leave them unconscious season. So make sure you stay with them until they're awake and alert or until help comes. Look at their wrist, see if they have a bracelet that might give you the medical information. Is there something nearby, like in the wallet, that tells you their medical history so that you can provide that to emergency medical services should it be necessary? Then, number 2, safety, safety, safety. Keep the person safe. If they're having a seizure and they're laying on the road, you don't want them run over by a car. You want to move them to the curb, so keep them safe. So safety first. Next thing, if they are unresponsive or unconscious, you want to make sure that you turn them on their side so they don't choke on their own secretions, like their saliva, or they may have food in their mouth. You don't want them to choke. So by turning them on the side, this opens up the airway and helps them not choke on any secretions. You never, ever, ever want to put anything in the mouth of someone having a seizure, okay? If they have tight clothing, like a turtleneck, kind of like what I'm wearing now, you want to make sure that you open up the zipper so that the neck is not constricted, so that they can breathe. And the next thing is, if you have a jacket or a blanket nearby, roll it and put it under their head so that you put something soft underneath their head. What not to do when there's a seizure? Never, ever, ever restrain the person. Never do that. And never put anything in their mouth. You know, the old wives' tale, put his foot in their mouth. Don't do it. Don't put your hands, or you may lose some fingers. Never put anything in the mouth of someone having a seizure. And certainly, let's mention safety, safety, safety. If they have rescue medications, like some people have nasal sprays, and you're aware of them, by all means, use it, so long as it's a prescribed medication. Now you know what to do. Dr. Deka Ifobi, keeping it real, board certified neurologist, functional medicine provider, and health and life coach. Have a beautiful day, my people.